right, so today is Tuesday, April 21st, and we have Vivian here who underwent a thread-guided facelift. We call it the hybrid technique. Basically, we use thread to anchor up everything where we want to see it. It's mostly a superior vertical vector rather than a horizontal vector. And once we, so one of the biggest issues with the thread is that it almost mimics a pretty good facelift, but it only lasts about a year's time. What it does is that when we try lifting it way too much, we see too much excess skin here. And for the longest time, I've been doing thread lifting for about now close to 9-10 years. And when we do too much thread lifting, we always see an excess bunching up of skin. And you don't want anybody to walk around with excess bunching of the skin. So the thread-guided facelift actually utilizes that. It actually takes advantage of the fact that the thread is so well made nowadays. The barb of it is so well designed. We can really bring it up in the vertical direction, and we see excess skin right around the periauricular area. And basically, a thread-guided facelift is removal of all the excess skin. As you can see, she's pretty tight here, and through it we access the various different layers, including the smashed layer, which is the preparata fascia. And we go ahead, when we undermine a limited undermining up to maybe about here, and we go ahead and we do a smash plication. So it's good old smash plication with removal of excess redundant skin that's readily visible once we go ahead and do the thread. What's great about this technique is that there's very little downtime. It takes advantage of the best part of the thread, which is almost nearly no downtime, and the lasting power of a traditional facelift. It probably won't last 7 to 8 years, but it will come pretty close, like more like 5, 6, 7 years. Best part is patient has almost nearly no downtime, and the scar heals flawlessly, and the jawline looks really good. Okay, and let's go ahead and showcase the jawline, and let's showcase right behind the ear. There's almost no scar to speak of. Let's go ahead and do the other side, and yeah, let's go ahead. Same thing here. She's healing really well, and let's go ahead here. Almost literally, she could wear her hair up within a week's time and be able to just go out and do whatever she needs to do without feeling uncomfortable. So, Vivian, give us your own word as to what your experience was.
My experience was wonderful. I love that you tell me exactly what you can and can't do. You don't overpromise, but you give me exactly what you promise. I wanted specifically to address the drooping a little here by my chin and my neck, and that's what we did. There was no general anesthesia. It was an in-office procedure. I literally went to work, I think after 3 days I kept my hair over my ears because there was stitches, but you know, I wasn't terribly bruised. I was a little swollen. 5 days after the surgery, I was actually able to make a video for my website, and nobody even knew I had anything done. People keep telling me I look great, but nobody has any idea what I did. I love that the healing process was so fast. That was great, and the results are great, and I could not be happier. Everybody just keeps telling me I look great, but I don't think they know what I did or if I did anything. I did go out to brunch with friends Sunday, and my friend Mark said to me, I don't know what you did, but you look amazing. So,
that's wonderful.
Yeah, it's great. I am really happy. Yeah. I feel confident, and I feel natural. Yeah. And that's exactly what I was looking for.
You know, there's so many ways to do a facelift, and everybody talks about what they're comfortable with. And in reality, you know, if you could be holding with your hands like this all day long, right? And people, when they come for consultation, they show exactly that. Dr. Kang, can you make me look like this all day long? You know, they talk about mini lift, max lift, deep plane lift. Those are just all just different terminologies, and ultimately the surgeon, once he gets there, he's going to do what he can do to optimize on the patient. For me, my clients, they want very natural look. They don't need to look 20 years younger. I always have this philosophy that you can always look 10 years younger, and as long as you can stay within your decade, but 10 years younger, that's the goal. And if you're 70, you know, hopefully you can look 60, but not, and sometimes if you look 30, 40, you can look a little awkward. You're going to be paying a certain price for that. And with this particular procedure, it encompasses three things that I want. It checks off all the three boxes. Quick recovery, natural, and the best part is there's absolutely no scar to show, okay? And now, how old are you? Let's tell the audience about your age.
I am 69. I'll be 70 in December.
Yeah, so I think we did a little better than a decade, I think. What do you think?
Well, you said it wasn't better to do more than a decade, so.
So we got a couple of bonus points for you.
Okay.
But thank you for allowing for us to do this. And there are a lot of people who are confused because some people, you know, always say do the minimal. Thread itself is just very, very minimalistic procedure. The deep plane lift can really put you on there for a long, long time with a long recovery process. So we need to find a compromise that fits everybody's lifestyle. And this, I think for a lot of people out there, this may be an option.
Yeah, I couldn't recommend it more. I'm so happy. I'm happy with the results, number one, but I was happy with the procedure. It wasn't too difficult, and it wasn't very painful. It was easy to care for, and the recovery was fast.
Thank you.